I am, and everyone knows, I am a rabid anti-smoker. You see, smoking killed my parents. From the age of 5, I remember vividly arguing with my parents to stop their habit. It was foul, it was smelly, it was dirty, and I detested it from the age of 5. And it even affected my little brother, who, despite growing with parents who smoked quite heavily, took up the habit as well, and has, of course, since died. My little brother is dead partly because of smoking. But as a doctor, I know there's a wealth of evidence to support the use of prescriptions to help people stopping smoking. I do this all the time. There's pills, there's potions, there's patches, there's sprays, and I always accompany that when I'm prescribing to patients by saying, these don't really work. They have an effect, they may be helpful for some, but most often people return to smoking after they have tried. It's a failure. 18% of the population currently smokes, 95% of prisoners currently smoke. So we have evidence that vaping helps people to stop smoking. But as a doctor, I also know it's important, it's imperative that patients have ownership of their own problems. There are some 25 specialist vape stores across our state. That's not counting the other commercial sources, the IGAs, the convenience stores that stock vape supplies. In recent months, I have spoken with a number of specialist stores and owners and people who are concerned with vaping. And I can tell you that they are worried for their future on a couple of fronts, two major fronts. The first, of course, is purely from business. My business is going to go down the tubes. I'm going to have no income. I have to close my store. What they're also worried about, the second thing, is that big tobacco is just sitting on the sidelines, waiting to step into the vacuum. The 25 vape stores that I have mentioned, they're not selling nicotine, because if they were, they'd be breaking the law, and the government would have already closed them down. I can prescribe nicotine, but the process for me to prescribe nicotine is actually really complex. It's even more complicated, I think, than prescribing cannabis. So what happens then, people find it much easier not to pay for a doctor, wait 45 or 55 minutes to see a doctor, get a prescription to go to the chemist, to have it ordered in to then mix with their vape. They don't do that, they just walk into the shop and buy some cigarettes. So we're making it more difficult for people to actually come off cigarettes because by well-meaning legislation, we're actually making it harder for people to stop. And is at least 95% less harmful than smoking. That is, smoking is at least 20 times more harmful to users than vaping. Evidence from Stop Smoking services show that vaping is effective for stopping smoking. Effective. These findings, along with our findings that vaping carries a small fraction of the health risks of smoking, suggest smokers should be encouraged to use vaping products. This is a government report in the UK. It's mirrored actually in other nations of the world. I desperately want to help people stop smoking. And we want to protect our most vulnerable from picking up the habit, which will have health implications of its own. Now, we can acknowledge that vaping can have a valuable role to play in reducing tobacco harm in our community, but we know also instinctively that for it to do the most good, vaping needs a suitable level of regulation, which in our case we have yet to draft. We need to take this out of the hands of big tobacco and into the hands of the medical available nicotine vapes to allow people to stop smoking, regulated and safe.
It's less bad. You're saying it's good, but what the report says is it's less bad. Doesn't mean we should allow it.
Well, I agree entirely. You made a very valid point there, and I do accept that. Less bad. The question is, will we allow people to accept the more bad, or do we want to have the less bad available?
Well,
it's an option.
It's also a new thing, so there's no long-term data.
And I do hope that our government will take that on board and allow us to investigate ourselves and see what the facts are from our point of view to get the science and the facts out, because I share entirely your point of view. We need to have the best outcome. The best outcome.
It is contested to some extent the degree to which vaping does help a person move away from tobacco smoking and move to less harmful consumption of nicotine. But certainly I have to say that I have met many people who have been lifelong smokers who certainly say that that has helped them. Our response has been to say, in a general sense, that you just simply cannot sell vaping devices. You cannot sell any components of vaping devices. That, you know, these are the people flogging these things aren't Mother Teresa. If you're not a pharmacist, you are not entitled to sell these at all, and you are breaking the law in selling these vaping products, components of vaping products, or the materials, the liquids that go into vaping materials. So it seems to be, in my view, there seems to be some confusion here.
The state government is interpreting the federal act.
Yeah,
Yes, and it's a grey area, and hence some of the confusion, and certainly some of the confusion for these vaping stores. So I do support the motion raised by the Honourable Dr. Walker. I think regulation in this space is a good idea. There is a desire in the community for them, and to go down the road of prohibition and to take a heavy-handed approach isn't going to stamp out that desire in the community. The government has had ample opportunity to get ahead of this issue. So vaping stores, vaping advocacy groups were saying for years that a harm reduction approach is better than the prohibition approach.
Actual vaping itself is not illegal, so no one stop it. So we haven't got a situation where people that are vaping are breaking the law.
No, the black market I'm referring to is buying the tobacco vapes at convenience stores. I don't know if members have tried, but going to basically any convenience store and asking for a nicotine vape is a very easy process.
We are supporters of vaping wholesalers and retail vape shops that operate within the law. We also support the government in their efforts to keep harmful products out of the hands of children. Non-nicotine vaping products has been proven to save lives. It stops people from smoking, which is, by the way, around 20 times more harmful than vaping. So why not focus on that instead of making it harder for small businesses to operate in what is already a difficult environment?
I think, and we heard evidence repeatedly that for some people, using e-cigarettes and vaping was an alternative to them smoking cigarettes. The evidence shows that the damage from e-cigarettes is less than the damage from traditional cigarettes.
Calling for, can I reassure you, I'm not hoping here to encourage vaping for children. What I'm hoping here is that the government will take the request to investigate this closer, to get a more sensible approach which would allow smoking to come zero, and that we are not going to have this scourge upon us anymore. I would dearly hope for that. And vaping, I think, is a reasonable approach to doing that, and the science that I've presented this as paper today would, I think, underline that. I do hope this will be taken seriously, because if we don't, then what we are doing is we're opening up a black market, and the black market is certainly one good way of encouraging people to actually get less healthy and to then take up smoking, because they do get addicted to nicotine and they will then buy the legal cigarettes. I'm asking here for research for the government to actually take a closer look at this, look at what's happening internationally. Why are the other countries, the other major governments supporting vaping? Take New Zealand, take the UK, take America, for example. Why are they doing that and we're going the opposite way? Are we doing it better or are we doing it less well than other countries? That's a valid question to be asked as a sensible government caring for the wellness of our citizens, the ones we have sworn to defend. Then I thank for the very helpful debate from both sides and the extreme emotions from both sides, that we can talk about this in sensible tones, supporting each other in our differences and understandings. Thank you. Because from this morning we had the questions, the questions regarding vaping and some uncertainties coming up, and I thought it's important that I just fill in some of the blanks there with some documents. My hard-working research team managed to pull this together quite quickly, and I think it's really important to put this on the record. So I'll shortly seek leave to table these papers, 3 of them. But first, a letter from GLR Law to the owners of a particular specialist vape shop from July of last year, in which they relate a legal advice obtained from the Department of Health, namely that, and I quote here, the Tobacco Control Department of the West Australian Health Department advised it is only illegal to sell a complete working device with all components from the one outlet. It is not, however, illegal to sell the individual parts or to sell all parts, provided it is between 2 separate outlets. I know, I don't understand it, but there we are. We are advised that you, that's the vape store, comply with this requirement. And secondly, I've also got a screenshot from the Department of Health's website, which explicitly states that e-cigarette liquids which do not contain nicotine are exempt from the 2016 ruling and are legal for sale in Western Australia. To my knowledge, that advice has been consistent on the website since at least 2019, and it says, and I quote, "The Western Australian Supreme Court decision does not encompass the sale of e-liquids, e-juice, vape juice. I am advised that the screenshot was taken in early 2022, and I can confirm that the information has been taken down since that date." Now, it was asked this morning how businesses could be operating if the products they were selling were not legal. A very valid question. I believe that question has been answered. This is, of course, some people's livelihoods we're dealing with here, so I want to be very, very clear. If the department took a different view to its long-established one in April, that view has not been communicated anywhere near adequately to the retailers or other interested parties. And in regard to interested third parties, I have a third document, which I will also seek to table, which is correspondence from the City of Kalgoorlie, Boulder, to another vendor. The City had also sought advice from the Department of Health and reported that, so long as a functioning vape device was not being sold, i.e. the device was broken down into parts, and those parts sold separately from different business premises, does that make sense? The sales were legal. That email correspondence is dated 31st January 2019, so again, significantly later than the 2016 case, which I believe the Minister was making reference this morning. Now, this makes me doubly glad because that we brought our motion, because what it has made crystal clear, I think, to all of us here is that there's both confusion and contradiction in the messaging from the Department of Health. And that confusion and contradiction is likely to have serious impact on people's livelihoods. It's about small business here. If it is now the government's contention that these hitherto legal businesses who have been operating on and under advice received from the Department of Health, they have now, through no change in their own practice, been deemed to have broken the law, then the government needs to make its intention on the matter clear. I think the intention is quite clear. You want to ban that. That's clear. I seek leave, however, to table the documents I have referenced and urge the government to consider them and their position as a matter of urgency.
Is leave granted? Leave is granted. The Honourable Alana McTiernan.
Thank you very much, President. Just very briefly, look, I thank the member for bringing that information forward. I do say that would have been actually very useful to have when we had the debate this morning, because it is quite central to your proposition. I will make sure that those materials are provided to the Minister for Health and that we will seek to get a comprehensive response.